The county is looking at that aspect through a program that will offer low-cost telemedicine services and increase prescription discounts. And of course, the question is, well, somebody's got to pay for it. How will it cost taxpayers? How about not a single penny? How's that? Here's Joe Paris.
If you're living in Ada County, Idaho, listen closely. There's a brand new county program that includes access to low-cost telemedicine services and increased prescription medicine discounts. Ada County recently opted into the Live Healthy Discount Program, a service that counties across the country utilize. Ada County Commissioner Kendra Kenyon says that having healthy residents affects not just the individual, but the entire community as well.
You know, the pandemic and now inflation and escalating healthcare costs. I just think it's so important that people get the mental health treatment, the medical treatment that they need. I think that this is really a role that community members can play and should play.
Commissioner Kenyon says she heard about the Live Healthy program while at a National Association of Counties meeting. A major selling point, the cost to taxpayers.
It's actually part of our fee that we pay to be a member of NACO. So it was at no cost to the county, to taxpayers.
Yeah, that's right. The service comes at no expense to taxpayers. Kenyon describes the need in our community right now.
Huge, unfortunately. I think Idaho has really been behind in terms of mental health identification and services. We've really lacked for decades here.
That was recently illustrated for Kenyon while visiting the Ada County Jail.
And when I go through the jail and I talk to the medical staff in there, we're learning that anywhere from 70 to 80% of everyone that is in our jail has a drug or alcohol addiction problem or depression or anxiety, and they're self-medicating. And so now our jails are full, and then a lot of these folks, unfortunately, are going on to prison, IDOC. And so it's just spirals, and and it's sad to see that people are not getting the help early on when they need, and the cost is exorbitant. So we can save a lot of money. So I'm not sure why we're not investing more upfront in the services that we need to be providing here.
To be clear, the Live Healthy program is not health insurance. The program gives residents of Ada County access to 24/7 telemedicine services provided through the low-fee health discount program. So that includes unlimited calls with a clinician without a copay. Now, residents can also get an average of 30% savings on prescriptions for themselves and their pets through the no-cost discount program. Commissioner Kenyon believes that investing in programs like this can be greatly beneficial on the individual and community level.
I think if we can be proactive and we can try to help people and they can help themselves more upfront, upstream, then we're not going to get the problems that we're seeing in our community.
So to be clear here, the program is at no cost to taxpayers, but again, the telemedicine portion of the service is $5.95 a month. No copays though, so that's kind of the trade-off. The prescription medicine discounts that we just talked about though, those are free. And the program as a whole, again, doesn't cost the taxpayers. And if you don't live in Ada County and you're curious if your county across Idaho might be a part of it, there are some other counties outside of our area that are. You can go to ktvb.com, you can click on this story, you can learn about the program, where it's available, how many discounts you're eligible for. And Commissioner Kenyon says, there's nothing to hide here. They're just trying to create a service to help people in need. And again, mental health in our community, something that leaders are focusing on.
Looking forward to hearing some of those success stories, too.
Yeah, for sure.
Thanks, Joe.